Ezra, can you introduce yourself?
Oh, hi. I'm a prescriber pharmacist and I've been doing aesthetics for 7 years. I had a chance to use the products and my patients are absolutely thrilled with the results. So now I feel like I can tell that after one treatment, you will see a result, whereas in a lot of treatments, I can't promise a result, which was a challenge for me as a practitioner. But now I was like, it is high price, but actually you will see a result after first session. So I really, really love the products.
Great. Thank you so much, Ezra, for sharing that with the others today. I think it's very important that they hear that. Eugene?
Hi. So I work at a clinic or young clinic, but I'll be moving to Sorensen Clinic quite soon. I really enjoy using the products. Really great results. I couldn't come to the Wigmore on Sunday, so that's why I'm really looking forward to your talk today. Because I really wanted to join, but I couldn't come on Sunday. So yeah, I'll be looking forward to it.
No, on Sunday, actually, I was speaking about a different subject. I was speaking about how to use the future of longevity. It was more what's coming in the future, but we will speak about ExoNature today. And so thank you. Sarah, you want to introduce yourself?
Hi, can everyone hear me?
Yes.
Hi, I'm Sarah. I run the non-surgical clinic for Dr. Yanis at 111 Harley Street.
Yeah, great.
Hi, yeah, I'm just here representing him and taking all the information for Dr. Yanis and our other doctors and nurses to potentially use moving forward.
Yes, great. Yes, we used to supply ASC to your clinic a number of years until last year. So now we've launched this new range, and it's, as you can hear, the feedback from both Ezra and Eugene. They have tried it, and we are getting amazing feedback actually. And I will let you, in my presentation, I will explain why this is actually the best exosome there is on the market right now. So thanks for joining, and we can have a chat as well later. Marina?
Oh, yes. Hello, everyone. I'm Marina Cole. Well, I have been alongside Dr. Damree for over 4 years now. Just recently, I have opened my own clinic in Tunbridge Wells Exosomes Clinic called Beyond the Face. I personally work alongside the maxillofacial plastic surgeon, Dr. Coombs, Darrell Coombs. So my main role is to work with pre and post-operative patients. But now with the clinic being on a high street, it just unveiled a great opportunity for the local residents to come and experience the exosomes treatments for skin rejuvenation and obviously for hair as well. Dr. Damree, I have a couple of questions to ask. So will it be a time for us to questions and answers at the end?
Yes, at the end, yes, after I do the presentation. And Kate, hi Kate, nice to see you.
Hi Shameema, how's you?
Yes, good. Just a little brief introduction about yourself, if you don't mind, so that the others get to know you as well.
Of course not. My name's Kate Harding. I'm a nurse prescriber, been in aesthetics nearly 20 years and into, these things, these blooming exosomes for as long as Shameema has, and always on her tail to see what she's up to next.
Yes, great. Kate and Marina actually came with me.
Hi, Marina.
We had a trip.
Hi, Kate.
We had a trip in Seoul in South Korea a few years ago. So we had a lot of fun then. All right, great. So we will start. Thanks everyone for joining. My name is Dr. Shameema Damree, and I have been heavily involved in the exosome world for a number of years. It's been 5 or 6 years now. Time flies, and every time we tend to innovate and introduce new technology. So the product that I have at the moment, I think, in my personal opinion, it is really the best product we have on the market. And I think this is for a number of reasons, but more importantly, we are getting the feedback from the clinicians, from the doctors, and the patients are very happy. Why is that? That's because they can see an immediate result, a medium-term result, and a long-term effect. So our market right now is inundated with exosome products at IMCAS and AMWC Monaco. Every other stand had exosomes. So it is very hard for, I think, the clinics now and the clinicians to choose which exosome to use and which one to trust. So that's why I'm here, and that's my job, because I look really deep into the manufacturing companies and I go and visit them, and I have the eyes now to be able to see what instruments they are using. Are they real exosomes? Are they not? And exosome world is quite complicated because we are bound by regulation, legislation, and everything else. So it's a very complex world, but hopefully I can answer most of your questions. So what we have actually, it is a bit of a gem, what we have. The journey everyone knows, but maybe for Sarah from 111 Skin, I was pioneering exosomes roughly 5 years ago, and I brought ASC manufactured by Exocombio to this country, but also globally. This was because, you know, I was a little bit ahead of everyone else to know what was coming up of stem cells, because my background is I trained into orthopedic surgery. Then we launched the Virtue RF or the Vivace, and we were doing these combination treatments with the multiple exosomes that we had. So I have been one of the global experts on exosomes, and I've presented in multiple countries, conferences. And we were pioneering these treatments whereby we were using medical devices in combination with exosomes to provide the best outcome for the patient. And you would see that now basically every company has integrated one or another form of exosomes with their medical device. This is because we saw the combination treatment was very powerful to either treat face or skin. So these are some of the publications that were from 3-4 years ago when I was first speaking about exosome and presenting to the press in the UK and internationally how to combine these treatments both for skin and hair. So I think the latest one we had was in the GQ magazine, that was last year in July. So what is important with any type of exosome? To know the source, to know the technology, to know the count, the purity, hence the regenerative and anti-inflammatory capacity of these exosomes. You know, in a perfect world, we want to use a human-derived exosome that is very powerful and is safe to use. However, in the UK and across Europe and across most countries now, we have to stick with a different type of technology because the human-derived products are not accepted as yet to be used in the clinics, right? So the question now has been, how do we manufacture an exosome product that is in close proximity, the clinical efficacy to the human-derived product, but we cannot use human source. So it's a real challenge, and that's why I've been working with this company called Primoris to advise them, in fact, as to what we should use to be able to engineer those exosomes, but also specifically how to load them so that they are specifically designed for the skin and hair and provide the maximum efficacy. So it has been a challenge even with them. So where are these exosomes coming from? I had a lot of experience from Exocombio. They were a startup company, but what I've found in my journey is that I need to progress from a startup company to a company that has actually 30 or more years of experience in stem cell manufacturing. And that's where CanStem comes into place. So these exosomes come from CanStem, a biotechnology company, a pharmaceutical company, and they have a lot of experience in stem cell. They manufacture drugs for more than 15 years. And they have been listed on the Korean stock market for 15 years. And Primoris Therapeutics and Primoris International are actually their subsidiary, which specializes in exosome technology. So they are trying to have the best exosome so that they can make the next generation of drugs. This is very important because when I visited them, then I realized their capacity, right? They have 7 clusters in South Korea, whereby they have all the R&D, all the GMP manufacturing, and they are very serious about science and clinical trial. So more than 30 years of stem cell manufacturing, almost 300 scientific papers being published. They have 20 US patents, and basically they are going to make the world's first vaccine against eczema and stem cell derived matrix to regrow cartilage in the joint. And they are trying to manufacture, to make, use stem cell technology to actually, grow skin from no skin. We call them skin organoids, and hair from no hair at all, which will help the plastic surgeons in skin grafting, in hair grafting. So this is what the future holds. So now we are still with exosome technology. So why choose these exosomes? Well, we had to dig deep, right? So we had to find an exosome that is kind of at its core plant-derived. So what we have chosen is 2 different types of plants. So I will skip this. This is the safety data. But choose 2 types of plants, right? So we chose ginseng. So we know that this is premium Panax Ginseng, which has been aged by a 15-year-old. And we are extracting the exosome from the ginseng. So on one arm, we have the ginseng exosome, and on the other arm, we have the Edelweiss flower exosome. But just the plant exosome is not adequate, right? So what Primoris really does well is they make peptides as well, biomimetic peptides. So we can load these peptides into the exosome to enhance their function, so that we can get the clinical effect of these end product as close as the human-derived product. And then what we add also in the solution, we have all amino acid, minerals, etc. But we have also added polynucleotide inside of the boosting solution, because we know that polynucleotide has a biostimulatory effect. And also teichoic acid, which is a super antioxidant. So you can see what we are doing. We are trying to combine a range of biostimulatory products so that the end result will stimulate the fibroblasts to produce so much collagen and elastin so that we mimic the action of the human. So this is the concept of the product. So now why we choose these ingredients? So the ginseng exosomes. So when we talk about plant-derived exosomes now, we have to know the characteristics of the plant, right? Of these exosomes, what they do. So ginseng is very powerful. It has been used over 2,000 years to make therapeutic medicinal actives, right? It has used a very strong pharmacological effect. It's very good to boost immunity, even cognitive function, which is brain function, cardiovascular, and liver benefits. Now, they have some key actives. We call them ginsensonides. They have over 40 of these ginsensonides because they have very strong antioxidant effect. They can stimulate the cellular metabolism, so make our cells more active. They can stimulate this Wnt beta-catenin signaling pathway. This is crucial for hair regeneration and skin repair. So because of all this mechanism, this is why this plant has been chosen. Also, they have phenols, and phenols in plants have very strong anti-inflammatory effect, antimicrobial effect. So when we talk about anti-inflammatory and antimicrobial effect, we are talking about the effect on acne and for sensitive skin, right? So we can downregulate the production of sebum, for example. Then we also have polysaccharides and peptides inside of these. So they enhance dermal fibroblast proliferation, collagen synthesis, they can improve hydration as well and rebuild the skin barrier. This is very important, for example, in eczema. So I get a lot of questions about why now we are using plant-derived exosomes. You know, what's the benefit of the exosome? A lot of people don't understand. We are using stem cell-derived exosomes. So even if it's a plant, before it can proliferate, they come from stem cells. And this is the true active that will make the plant differentiate. So they have potent effect. We used to think about plant extract, but the concentrate to be able to have the maximum efficacy of these plants is to extract the exosomes, to culture the stem cell, then to extract these exosomes from them and to have billions of these particles. This is the reason why we need a proper manufacturing lab to be able to have these exosome products, right? So going back to the ginseng, so it's very important to understand what is the aesthetic and regenerative capacity. So as I told you, there is one line in this, it says improvement of mitochondrial function and anti-aging properties, right? And oxidative prevention of oxidative aging. We know, I gave a talk at Wigmore about longevity. We talk a lot about this aging is because of inflammation. And in the future, we want to be able to increase mitochondrial function because the mitochondria are actually the powerhouse of the cells, right? So this is one of the key functions of these exosomes. And also we want to activate the synthesis of collagen type 1 and 3, and that improves the elasticity of the skin and also the firmness. And there are some enzymes as well, which are responsible for collagen degradation. For example, these MMP1 and 9. So we are delaying this aging process. All this has been proven, and I can share the book with you. We have like a Bible for exosomes, plant-derived exosomes, right? And each one of them, what they do. The other thing that we care about is to suppress melanogenesis, right? Because if we want to make someone look younger, we have to actually reduce the redness and reduce the pigments, because the more pigment we have, the skin doesn't look flawless, right? And with age and sun exposure, the melanocytes actually are overstimulated, and that's how we get the pigmentation and these age spots. So we have to suppress melanogenesis. Also, we have to reduce inflammation at its core. And that's how we also protect the telomeres, and delay the cellular senescence. Therefore, we are improving skin longevity. There's a lot of emphasis these days about longevity. So even skin and hair has longevity, not only the body. And also we want to strengthen the capillaries so that we improve the microcirculation of the skin. We want to promote the delivery of oxygen and nutrients to the skin and hair. So that's why we have chosen this particular exosome from ginseng. So now also for the regeneration of the hair follicles, what we know is that exosomes from ginseng, they prolong the anagen phase. And the anagen phase of the hair cycle is whereby the hair is growing. They have some specific pathways. And here we can see how it is altering this beta-catenin pathway. Also, we have anti-inflammatory properties of the ginseng, because with the scalp as well, when it is inflamed, that's when we start to lose hair. Okay, so we also want to improve the microcirculation of the scalp. Therefore, that's how we know ginseng provides ATP. So ATP is a form of energy. And these ginsenoside that we have learned about, they regulate sebum production, right? And there are some scalp disorders that are linked to having excess dandruff or excess, that's why we have disorders of the scalp. So the antimicrobial effects of these ginsenoside, they actually will be very effective actually for the scalp. So now we are talking about regeneration of hair follicles, right? Because what we want to do is not only have healthier hair, thicker, longer, denser hair, but we also want to be able to regenerate the hair. We do know that, I presented that in Monaco a few years ago, that when we were using exosomes, actually, we could reverse potentially, not in everyone, but in some patients, reverse the aging process of the hair, whereby now we can see sometimes the hair that is growing back is actually more youthful and more pigmented even. So that's the reason why it's important to have, very good exosomes. So as I explained to you, ExoNature, we are basically identifying the best plants here from both Asia and from the Swiss Alps. So the Panax Ginseng exosome from Asia and the Edelweiss exosome from the Swiss Alps, and the pentacore peptide. So Primoris Therapeutics is very good because they have been able to make this very giant complex, which comprises of 5 different peptides, and each peptide is responsible to do a specific function in the skin and hair. So we identified 5 core peptides: copper tripeptide, oligopeptide, dipeptide, tripeptide, and palmitopentapeptide. And I will let you know what they do. And then our key active also is PDRN. So this is the diagrammatic representation of this quadruple biotech product that we are presenting. So the Panax Ginseng exosome, the Edelweiss exosome, and let's say the tripeptide is good against inflammation. It also induces dermal growth. The dipeptide, antioxidant, and the palmitopentapeptide, it's effective against wrinkle, but also to reduce transepidermal water loss, right? We're trying to rebuild the skin barrier. There is a lot of talk about maintaining the skin microbiome. We should not disrupt the skin barrier. If we do we know now, we do too many laser treatments, we do too many aggressive treatments, we will age faster, right? So this reduction in transepidermal water loss is very important. And also the copper tripeptide, we are improving the elasticity of the skin, have anti-inflammatory effect, and the oligopeptide, we are promoting collagen synthesis and the cell adhesion enhancement. So improving the communication between the cells with the peptides and the exosomes. So that is the core of the technology, and that's present in the vial 1, and we are lyophilizing, making a powder. So first we culture the stem cell, second we load them with the peptides, third then we make them a powder and we stabilize it. So that's the principle of it. So what we can see, this I can share with you, but it's again going deep into the science of why we are using exosome from ginseng to reduce oxidative stress, for example, inhibit UV-induced cell death, because when we are exposed to the sun, our cells are aging. So that is one of the key factors, right? People always ask me, do you wear sunscreen? I always say, no, I don't wear sunscreen, but maybe I'm using other biologics that are helping my skin to prevent itself from the UV damage from the sun, right? So exosomes is one of them. And I think in the last 5 years, I've consistently seen, how youthful we can regenerate the skin, right, by using exosomes. Here also, we are preventing cell death by UV radiation. So these exosomes are very powerful. And then if you want to dig deeper into epigenetic changes, we are talking about now, right, how our cells, our genes are changing actually as we age, but also the change in the skin. So these exosomes, they have protective factors against that. So you see here, we need multifunctional effect of the exosome. We do a lot of treatments in our clinic, right? Just starting from simple microneedling RF, we can do a CO2 and erbium laser. In all of them, we are traumatizing the skin, and we want the skin to be able to heal, right? Then afterwards, we will have a regenerative effect. So what we learned is that when we cause a trauma to the skin with a medical device, if at the same time we can promote the wound healing capacity, then we are better off. So that's why we want to combine the exosomes as soon as we have created the trauma, so that we can start the healing process right away. So that's why we have pioneered these regenerative advanced treatments with the medical devices. Then we want them to have anti-inflammatory properties, right? Everything related to aging or disease process is because it's pro-inflammatory. Our cells are overly inflamed. So the most powerful effect of an exosome is the anti-inflammatory action. And then also to have the antioxidant effect as well. So we need these multifunctions to be able to have a true effect. Now, you know how the Koreans, or a lot of where the technologies are coming from, we want to have a brightening effect, right? So what we can see is that here the Panax Ginseng exosome is actually inhibiting the expression of tyrosinase. And we know this is the gene responsible for melasma and freckles. So in fact, these nanoparticles, because they are so small, the exosome, they can act on these pathways, tyrosinase pathways, so that we can even have a genetic effect on the cells, right? So this is very complex, but it's a very good thing that the exosomes can do. So that's in regards to the Panax Ginseng exosomes. Now, the pentacle peptides, this is the Edelweiss exosomes. So the Edelweiss exosomes, they have different function, right? So the Edelweiss is a plant that grows in very high altitude in the Swiss, in between the Swiss, Austrian, German Alps. That's where they grow. And they are very resilient. They have been used for a number of years in a lot of anti-aging and cosmetic products as well. So we do know that they have a very good effect on skin elasticity. They are very good to prevent anti-aging, and again, they have a very good anti-inflammatory effect as well. It's quite interesting to see here. You see the exosomes are very small particles, so they are nanovesicle. And why I am showing you this graph of how we analyze and track the exosome by this nano-tracking analysis, we call it, is because to show you this, we say 164.5 nanometers in diameter of each of these exosomes means that we are not rupturing the membrane of these exosomes. We know we need intact vesicles for them to be active. That's why there are so many exosomes products on the market that do not work, because in fact, when we are buying them, maybe they have already undergone, some degradation process. So I keep saying exosome needs to be powder form if we want them to be at room temperature. So if you look at all of the market right now, you see liquid form exosome at room temperature. We are not buying exosome, right? So this is the core principle of it. Otherwise, you need to freeze it and you need to make it frozen. So either you're buying something which is a liquid form, which is basically deep frozen, and that's probably an exosome, and it's probably very expensive because of the logistics aspect of it, or you buy a powder form exosome. And not all exosomes are also technically injectable grade, right? Against the regulation, but we still want to use a product which is pharmaceutical, therapeutic grade, injectable grade, because it's the most premium. So that's why this product is expensive, because we are abiding by all of the characteristics of exosomes. So here, again, I keep saying about inflammation is very important. 61% decrease in inflammation and also these oxygen reactive species. So basically, we want the cells to survive for longer. That's what we want to see in the lab. So Edelweiss, in terms of its antioxidant capacity, is very good because we are comparing it with vitamin C. Vitamin C, as you know, is one of the most prominent antioxidants that there have been. So we know here that these Edelweiss Callus exosomes, they are even stronger than vitamin C in their antioxidant power when we are using them at the high concentration. So it's important to see that. And it can increase collagen type 1 by 150% and fibronectin by 200%. This is what is responsible for elastin production. So also what's important, the wound healing capacity. So all these exosomes, you can see they are doing pretty much, you know, the same core functions we want them to do for the skin. These tumor necrosis factor alpha and interleukin-6, basically they are cytokines. So they have some pro-inflammatory effects. So we want to reduce them. So that's very important in dermatological conditions to reduce these. So now let's go to the peptide. This company is very good at manufacturing peptide. And as I've said before, each peptide is for a different function. So we have these 5 peptides. So when we take the 5 peptides and use them together, that they will have this synergistic benefit with the exosomes. So basically, we will get an exosome that is more powerful. So what's in the product, basically? So we have 2 products, 2 range of products. One product is, so one of them, the range is the 200 billion. So we have called it ExoNature 200 billion SB plus for the skin. And this, we have 200 billion particles of exosomes in them, and also the pentacle peptide. And they are made in a GMP facility. So here, what you would have is the Panax Ginseng vesicles, the vesicles from the Edelweiss, and all the different types of peptides. And then what we have done very well is to have this boosting solution. The boosting solution, this is excellent. Actually, even on its own as an advanced mesotherapy product, right? First of all, it is injectable grade, right? Doesn't mean we don't want to inject it. What I'm saying is that the quality of it is very high. So what we have is a range of amino acids, a range of minerals, vitamins, and we have 8 different molecular weights of HA. We want the HA to go into the different depths of the skin and really deep dermis as well, to be able to hydrate all the different depths of the skin. We have teichoic acid. Teichoic acid is alpha lipoic acid. This is what they use, for example, in Korea, intravenous to boost energy in cells, right? So this is a super antioxidant. 400 times it is more powerful than ascorbic acid, which is vitamin C. And then we have some stem cell culture extracts. Glutathione, again, is an antioxidant, and it's very good for skin brightening. And it also gives energy to the cells. And our hero ingredient here is the polynucleotide. So all together, this is why this solution is very good in combination with the 200 billion exosome. Some clinics have reported, they say, but doctor, there's only 3 ml of solution, but it's very concentrated. So it's about the concentration of the actives more so than the number of mils of solution that we have. So together, when we take the 200 billion exosomes and with over 150 actives in this, we have a very good product for skin and a very good product for hair. But also we have created another line of product because the previous product is a bit pricey. So to be affordable as well, exosomes, we have created a product, basically the same principles, but we have 40 billion in this vial. So our aim is basically to be able to do a course of treatment and perhaps the maintenance with the 40 billion exosomes. So that's why we have also the 40 billion. So the price of the 40 billion exosome is 78 pounds a set, and the price of the 200 billion is 130 pounds a set for a treatment. So now if we talk about hair, basically, we do know the gold standard for hair regrowth is minoxidil, and it has been proven to work. However, it has side effects, and also, you know, when we stop using the minoxidil, well, the hair, either it falls or we stop having the effect. So how do we compare basically minoxidil to exosome, and why choose exosome? Or in the future, why not load the minoxidil inside of the exosome and make a drug, which is exosome-based minoxidil, right? So this is in the pipeline as well of this manufacturing company to make the next generation of minoxidil drug by using exosome as a drug delivery system, but we are not there yet. So if we look at minoxidil, these are the hair follicle you can see that we have used in the lab, and then we have the exosome hair follicle. What you can appreciate here is that the exosome hair follicle, you can see the hair bulb is bigger. By that, what we mean is that we have been able to regenerate the bulb, the hair bulb, because we know that when we have a thicker hair bulb, this is what signifies a youthful hair. And also we can see here that the density of the hair shaft has increased. So we know as we age, we get thinner hair. So the exosomes are actually working on the cellular level of the hair cycle to produce a hair follicle that is thicker, so denser hair we will get, and also rejuvenated hair because we are turning back the clock of the hair follicle itself. So it's very interesting. And we can see that, in fact, in comparison to minoxidil, exosome is more powerful. We have 19% more hair growth in the lab when we use exosome versus minoxidil. So it's very impressive what we can achieve. But also you can see here, what we tend to see is that so when we use minoxidil, in fact, the hair root diameter is reducing by 13%. And also the catagen hair rate, we have a 30% decrease in the catagen hair rate. So basically, we are showing that exosomes actually have a better effect than minoxidil. So it's very impressive. So our exosomes, when we tested them, we do know that the higher concentration of exosome is needed to have a very good stimulation of the hair follicle. Here you can see, again, we have used a concentration of 200 billion of exosomes. It's the highest count on the market. And I think especially when we want to regrow hair, more so than even the skin, we need the higher count. It's very important. And you will see, compared to other products that are 10, 20 billion on the market, this one, the 200 billion, you will get faster hair growth. And we know patients, you know, they are not very patient, right? They want to see results. So in comparison to PRP, you will see the 200 billion hair, we will get much faster result, or any other exosomes. So basically here, apart from regrowing the hair itself, it is promoting, basically maintaining the scalp health. So the key is to have a better, healthier scalp with less inflammation and less scalp disorders, so that you have, you know, a better, basically we call it, we called it a soil and root effect, right? So basically, if you have a better soil, which is the scalp, then you will have a better hair follicle in the end. So that's why we concentrate so much about the health of the scalp. When I was in Korea, I share with you, I visited a lot of clinics and a lot of hair specialized centers. They were actually measuring the temperature of the scalp, because they were explaining to me that if you have a hot scalp, right, the temperature is higher, actually you get less hair growth. So it was quite fascinating. If you have an inflamed scalp, it's harder to regrow hair. So they were actually treating the scalp by cooling the temperature of the scalp, or having products that cool the scalp or freeze the scalp. So what's the other option is exosome, to have anti-inflammatory actions on the scalp. So it was very interesting. Also, we want to reduce the itchiness of the scalp, the dryness of the scalp. So in these exosome products, we can use them for different types of alopecias, whether they are male pattern hair loss, female pattern hair loss, you can use them. We know that they work on different types of hair loss. So androgenetic alopecia, whereby you are losing hair because of the genetic predisposition, or alopecia areata, whereby you have an autoimmune condition, or even very complex cases, right, like alopecia universalis, also has been successful. So I treat my patients regularly with basically only hair exosomes now, and they work really well. And I tend to combine it with a device if you have. So if you have a microneedling pen, simple, right, use that, because at the depth at which you would use the microneedling pen, for example, at 1 millimeter or 0.8 on the scalp, you are directing the exosome to the depth. The exosome work by a concept of homing, right? Homing mechanism. You need to direct them. They're like little satellites. So even if I pioneered this microneedling RF protocol with the hair, so we are shooting at 3 different levels in the scalp. We shoot at 1.2, at 1, 0.8. Why we are doing that? Because we are directing the exosomes to the depth in which the hair follicle is located. And the hair follicle is located at 0.8 millimeters from the scalp. So we are directing the exosome slightly below the hair follicle into the hair follicle and above, you see? So there is a science as to what we are doing. So for the hair, this is what I would use. The 200 billion exosome and the peptides are also very good for the scalp. And then what we also did was we added, you see, biotin, of course, because we know biotin works, right, to increase the hair density. So we loaded the biotin into the exosomes. It only makes sense. So then we have what we call a function enhanced exosomes. This is the word to describe them. They are not just exosome. They are exosome enhanced with peptides, growth factors, biotin. They would work better. And the boosting solution as well has a stem cell culture. So again, we need these, all the actives together to be able to have the end result, right? That's what we are learning. So basically, we have 200 billion exosomes for skin and hair. We have a boosting solution, or we can use an activating solution. Why we made 2 different solutions? Because maybe there are some patients who don't want to use salmon-derived PDRN, right? So that's why I made the manufacturing company make one without. So it only makes sense. So the product this has, the product range, the product line has been very well thought through, because it's taken my clinical experience over 5 years with the manufacturing company's 30 years of experience to make this, so that it is suitable for every type of client that we have encountered so far, right? So basically, so this is not, there was another product before. Okay, so I'll introduce this to you because this is, I think, really, really good, right? So this is, it's almost like a world's first. It's a vaginal gel that contains actually exosomes, contains peptide, contains lactic acid, low dose hyaluronic acid, so that we can use it, first of all, for menopause. I think is brilliant. Whether you are perimenopausal, menopausal, or postmenopausal, the patients, they all suffer from vaginal dryness, itchiness. So this would actually be very good for that. But also for the younger patients. Younger patients, they have a disturbed flora of the vagina, right? So the pH is disturbed. And when that happens, Candida albicans, right, they start to flourish and grow. So that's why we end up with vaginal thrush, and also too many times having vaginal thrush is also linked with a number of UTI problems as well. So what we have shown in the lab that these exosomes are antibacterial effect. So they have a positive impact on reducing the Candida albicans. So therefore, it's helping for vaginal thrush. But the exosomes, what they do is very good to enhance vaginal rejuvenation, tightening, hydration, and yes, sexual function as well. There were some patients who have tried these, and actually the libido has been enhanced, and both them and their partners are quite pleased actually. But how to use this? So there are lots of clinics, they do vaginal laser, for example, with CO2. They can do HIFU of the vagina, RF treatments of the vagina. So we would recommend to actually use one of these kind of pessaries after you do the vaginal treatment in the clinic, and then you will sell them as a retail product. And they would use it twice a week, this vaginal gel. So they would insert it inside of the vagina before going to bed at night. And then the vagina will, the mucosa will absorb the product. And then in the morning, you just have a shower. And 2-3 times, having used this product, even I can see and feel the difference as well. So this is a very unique product. And then, of course, we have the mask. So this is a very premium mask because there are lots of masks on the market, right? But this has been designed with a special fabric. And the fabric actually, it's this premium Cupra fabric, which is adaptable. We can use it after resurfacing treatments, such as laser treatments. We can safely use it after a CO2 laser, aggressive erbium resurfacing, microneedling RF. And we have designed this mask so that we can reduce downtime, because we don't want the patient to be walking out of the clinic all red, right? So this is being really well done so that we can reduce the downtime, but also we want to address pigmentation. We want to reduce any risk of PIH, and also promote, have an anti-aging benefit. And everyone who's had it, for example, do a microneedling treatment with the 200 billion exosome, apply the mask, place the patient under the LED light, red or blue, and you can really see the effect of the entire treatment. So I think that's the product portfolio for you.